Good day. This is Michelle Jane Sevilla from BSM 111B, and today I am going to perform a thorax assessment during demonstration. So prior to the conduct of the procedure, first I am going to review my client's previous medical record if available, which is done to identify patient instances of harm, medical history, and current treatment procedures. Second would be to determine the scope of the assessment, which would include the anterior and posterior thorax and lungs using the IPPA, inspection, palpation, percussion, and auscultation. And of course, prepare the necessary equipment needed, which includes a skin marker, a centimeter ruler, and a stethoscope. So the third thing to do before conducting the procedure is to perform hand hygiene to protect the patient and myself from infection and cross-contamination. Good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today. Please state your name and your birthday, please.
My name is Leia Emperano.
Thank you, ma'am. So how do you like you to call?
It's fine.
Okay, so today I'll be doing a thorax assessment, which means that I need to ask you to stand up, to sit down, to change your clothes, and of course to palpate or touch your upper extremities. Would that be alright?
Yes.
Okay, so do you have any questions and clarifications?
And so for now.
Okay, will that be alright if I close the door and so no one from the outside will be able to disturb you while doing the assessment?
Yes, bro.
Okay, ma'am, this is your patient gown. Please change into this. So now that you have changed into your gown, I will now check for signs of respiratory distress or problems with oxygenation. So I will now check for your face and lips. So may I see your fingernails? Okay. Are you experiencing any difficulty in breathing or shortness of breath or chest pain? So now I'll be palpating for your trachea. So ma'am, I need you to stand up and put your arms on the sides. So now I will assess for lateral deviation of the spine. So can you bend for me, ma'am? So I am just looking for any deviation or abnormal curvatures of your spine, which you don't have. So you can now stand back up and you can now sit. So this time, I will be palpating for your posterior thorax. So allow me to palpate your back. So can you please turn your back. So I will now palpate for temperature. So this time, I will palpate for boldness and tenderness. So ma'am, please tell me if you feel any pain. Okay, so now I will palpate for the posterior thorax for respiratory excursion. So can you inhale and exhale deeply for me, ma'am? Again. Again. Okay, thank you. Okay, ma'am, I will now assess your tactile frenulus. I need you to count 1 to 3 whenever you feel my hand touching your back, okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
One, two, three. One, two, three. One.
So now I will now forecast your posterior thorax. So ma'am, I need you to cross your arms over your shoulder and bend your head forward a little. Okay, ma'am, I need you to inhale, exhale, and hold it in from me, please. So I'll just get my mark to mark your back. So now I need you to inhale and hold it in for me, please. And I'll mark it in. So I will repeat the procedure again on the other side. Is that okay? So I'll need you again to inhale and exhale and hold it for me, please. And I will mark again. So now, can you please inhale and hold it for me? And I'll mark again. So now I'll be listening for your breath sounds. So I need you to inhale and exhale with your mouth open. Okay? I'll just get my stethoscope. Okay, now, ma'am, I need you to repeat saying the word 99.
99. 99. 99. 99.
Now I need you to say the word E. 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 This time I need you to whisper 1, 2, 3. time, I will be assessing the anterior thorax, so I need you to face me this time, ma'am. So I will now inspect for your breathing patterns such as respiratory rate and rhythm to assess for any abnormalities. Okay, so just breathe normally. So lastly, I will inspect the postal angle and the angle at which the ribs enter the spine to assess for any abnormalities. So I will now palpate your anterior thorax for tenderness, sensation, and surface masses, okay? So I will now palpate your anterior thorax for tenderness, sensation, and surface masses, okay? So now I will palpate the anterior thorax for expulsion. So I need you to inhale and exhale for me, ma'am. Again. Again. Okay, thank you. So now I'll be percussing your anterior thorax. So this time I will auscultate for anterior thorax. So I need you to inhale and exhale deeply, okay? Okay, this time, ma'am, to sum up everything that we've covered. So your spine is vertically aligned and straight, and while palpating for your anterior and posterior thorax, your skin is intact and temperature is uniform. So there are also no tenderness or masses. So while I was listening to your breath sound, it was also normal. So your breathing pattern is quiet, rhythmic, and effortless respirations. So basically, everything is normal. So do you have any questions or clarifications? Okay, ma'am. Thank you for today and for your cooperation. So I'll see you next time. So you can now close your gown. Okay, so that's it for today. Thank you very much for your cooperation. So see you next time. So after that, I will perform hand hygiene. So that's it for the assessment of the thorax. Thank you.